suppose I conceive clinical epidemiology as the science which enables us to do good clinical research.
Clinical epidemiology is the science behind evidence-based clinical decision-making.
Clinical epidemiology is the application of epidemiologic principles to clinical research.
Clinical epidemiology makes me a better doctor. I can't remember how I practiced without knowing what I learned in clinical epidemiology. Certainly, I had no idea about how to appraise studies that I read in medical journals. I had no idea how to appraise or understand the media representation of clinical research. And now I feel much better able to see through the spin and get to the real nitty-gritty of what matters and what the truth is in medicine.
So clinical epidemiology is important because it incorporates the best research evidence into clinical decision making, and it helps clinicians and their patients make better healthcare decisions.
It's extremely good for your career. It gives you the skills that you need it gives you much stronger evidence-based medicine skills than you get out of med school and out of your early years in clinical practice. It enables you to do research, and it will be an ideal starting point for doing a PhD based on clinical research. It opens a whole lot of doors in terms of your career. There's a whole lot of people I know who've studied clinical epidemiology who have said to me they can't believe that they didn't learn this stuff earlier, and they don't think anyone should be doing research if they hadn't studied clinical epidemiology.
Either they might want to become better clinicians, might want to be better doctors, better nurses, better occupational therapists, better pharmacists, better physiotherapists. So given that all of these disciplines are science-based disciplines, all of them are based upon wanting to do better for the patients that they treat using research, then clinical epidemiology provides them the skills so that they can use research better. There would be others who aren't content with just using research. They want to develop their own research. They want to become research leaders. And here clinical epidemiology provides them the skills that they can do their own research in their own content area, be that, kidney disease or primary care or infectious diseases or whatever.
It can be for people of quite different backgrounds. We have people from medicine, clearly doing this, but we also have people from allied health areas, so physiotherapists, we have pharmacists doing this, we have people who work in the pharmaceutical industry that do our course, we have people from research backgrounds who want to improve their research skills who do our course as well.
Many of my fellow students have taken this to the traditional career pathway in clinical medicine and become leaders in that as well as in clinical research. However, other colleagues have taken the skills to other interesting areas such as government regulatory bodies, health system management, health policy, as well as the pharmaceutical industry.
So a degree in clinical epidemiology might give you the skills that you need to become more competitive in the workplace and to get onto a specialty training program. A degree in clinical epidemiology might also give you some research skills that can be a stepping stone towards a higher research degree such as a PhD, and might give you the skills that you need to become more involved in clinical research in the future.